Hi, everyone. I'm Michelle Jobin, and you are listening to Time to Talk, a podcast for caregivers. This podcast is dedicated to helping family caregivers in Ontario. Through expert tips and resources, you will gain knowledge and validation for the ups and downs that come with caregiving. More importantly, you'll learn that you're not alone. It's so important to take this time for yourself. We're glad you're here. Today, we are joined by Holly Prince and Jessica Wyatt. Holly and Jess work at CERAH, the Center for Education and Research on Aging and Health at Lakehead University. CERAH was established in 1991 to develop and deliver educational programming in aging and health to interdisciplinary healthcare professionals. As the center's educational activities expanded, so did the scope of CERAH's activities to include aging and health research. Today, CERAH uses collaborative interdisciplinary approaches to develop and administer a wide range of research and continuing education programs. They are dedicated to providing resources and support with a focus on Indigenous health equity and palliative care. They developed a curriculum for caregivers in Indigenous communities. Holly and Jessica, thank you so much for being here with us today. And before we begin, I would like to acknowledge that I am located on the treaty lands and territory of the Mississaugas of the Credit First Nation and the traditional territory of the Haudenosaunee and the Wendat. It is now home to many diverse First Nations, Inuit, and Métis people.
Miigwech, Michelle, and to the Ontario Caregivers Organization for inviting us here today to talk about some of the work we are leading around caregiving and Indigenous peoples. So Bojo, I introduce myself in my own language, which is a sacred protocol, and in doing so, I am honoring my Anishinaabeg identity, my teachings, and my connections to all my relations. I want to begin by paying my respects to the elders past, present, and future, for they hold the knowledge, traditions, teachings, and future hopes of my people. I also want to recognize that the land that CERAH at Lakehead University is located on is a traditional territory of the Anishinaabeg, home to Fort William First Nation, who are signatories to the Robson Superior Treaty of 1850. My English name is Holly Prince, and I am an Anishinaabe and member of Opawaganissaning here in Northwestern Ontario. I am a social worker by background, currently doing my PhD in education. I am the lead for the Indigenous Peoples Health and Aging Division at CERAH, where I work as a project manager. Part of my role is to plan, implement, and evaluate palliative care education and health equity initiatives for Indigenous peoples. A central component of what I do is to advocate for equity through culturally and contextually relevant care. Jessica?
Thanks, Holly. I am a white settler, originally from Treaty 9 territory in northeastern Ontario, Timmins specifically, and I'm currently living in Thunder Bay on the traditional lands of the Fort William First Nation, signatory to the Robson Superior Treaty of 1850. And I, along with other teammates at CERAH, have committed to educating myself through cultural safety training and anti-racism training. And some of the ways that I'm doing that work is by completing the University of Alberta Indigenous Canada course, as well as the Sanya's Indigenous Cultural Safety online training, and decolonizing my virtual world by reading and following Indigenous academics, activists, artists, and creators. I work at the center as a knowledge broker, supporting the coordination of palliative care education delivery for Indigenous communities across Canada. And my education background is in education, English, women's studies, and most recently, I have completed my certification to be a project management professional.
Thank you so much to both of you for being on Time to Talk today. We really want to create a space here where Ontario caregivers can connect and share, and hopefully by our conversation today, by learning about your experiences, your knowledge, your expertise, and specifically what you do at CERAH, our listeners can gain a little bit more insight into your journey and learn more about the importance of the diverse health needs of the Indigenous peoples of Canada. So, I'd really love to find out more about CERAH and the work that you do. So can you tell us about the center and the 4 key research areas that it covers?
Sure. So the Center for Education and Research on Aging and Health, also known as CERAH, at Lakehead University was established in 1991, and it was originally called the Northern Education Center for Aging and Health, NECA, because the center's focus was to develop and deliver educational programming in aging and health to an interdisciplinary healthcare professionals in Northwestern Ontario, as well as Lakehead University students working in health professions. In 2004, to reflect the increased focus on research, NECA was then renamed to CERAH, and with a mission to conduct high-quality knowledge translation, rigorous research, and education, CERAH continues to bring together healthcare professionals, community partners, leaders, educators, researchers, students, caregivers, and older adults in a collaborative effort to advance health and social care, promoting the health and well-being of people aging across the life cycle. Our key areas that we work in include aging in place, dementia and seniors mental health, Indigenous people's health and aging, as well as palliative care. The Aging in Place aims to support seniors who want to age in place while maintaining independence and remaining connected to their community. The Dementia and Seniors Mental Health team work directly with people living with dementia and seniors with mental health conditions, their families, supports, and system partners to conduct research that tells people's stories in ways that challenge traditional discourses of aging, dementia, and mental health. And they also enhance community capacity through partnerships, knowledge translation, and innovation to better support the care of those with lived experience of dementia and to support seniors' mental health. I'm going to let Holly speak to our Indigenous people's health aging, but before she does that, our palliative care team has been centrally coordinating and delivering interprofessional palliative care education in Northwestern Ontario since 1993. And we provide a number of palliative care educational events throughout the year. These events are organized with healthcare personnel throughout Northwestern Ontario, with a particular focus on people working in the community and in long-term care.
Thanks, Jessica. In terms of our Indigenous People's Health and Aging Division, this is a division at CERAH that looks at leading culturally relevant research and education in partnership with Indigenous peoples, and really looks at creating space to amplify Indigenous people's voices through knowledge translation and program development opportunities. Since about 2009, CERAH has been a leader in developing, coordinating, and delivering palliative care education to Indigenous communities across Canada. And this education is developed for all levels of community care, including training for registered and unregistered health and social care providers and community caregivers. Miigwech.
In terms of your background and experience, and that's great to know sort of just the full picture of what the center does, how did both of you find yourselves working at the center?
Well, for myself, in 2002, my friend, who was 24 years old at the time, was diagnosed with cancer. His family came from a remote First Nations community in Northern Ontario, and I had journeyed with him throughout his illness, all the way to the Princess Margaret Hospital in Toronto, where he transitioned back to the spirit world. And this was such a challenging experience for myself, and it really opened my eyes to the extreme gaps and barriers to culturally relevant healthcare. My friend's family's philosophy on life and death, their meaningful interactions with the spirit world, their use of traditional healers and medicines, and the need for the large extended family members really, pointed to a severe disconnect between Indigenous worldviews with the approach of the westernized medical system. So in 2003, a year after my friend had passed, I had entered the Master's in Social Work program at Lakehead University, and I changed my direction from working in addictions and mental health to really navigating and researching westernized healthcare systems to improve care for Indigenous peoples at end of life. So I really want to learn more about the care and health systems that can support people at end of life, the challenges and barriers to equitable access, while also exploring ways to improve policies and programs and services for Indigenous peoples. I also changed my focus from clinical social work to macro social work practice, really embracing research and policy. So when I was doing my master's, I worked with 2 Indigenous communities in Northwestern Ontario, really trying to understand the perspectives and experiences of the elders and their educational needs of their community caregivers. And at the time, I was mentored by Dr. Mary Lou Kelly, who was a professor in the School of Social Work and director at the center. And my master's in social work project, really provided that foundation for further funded education and research projects that we brought down here to the center because it was addressing a gap in services, in knowledge, and in policy. So since 2005, I have been working at the center with elders, Indigenous and non-Indigenous health and social care providers, and Indigenous communities across Canada, looking at developing tools and resources and conducting research that meets their needs. Miigwech. Jess?
So my story is obviously different than Holly's experience. When I was finishing my master's degree in 2008, I knew at that time that I wasn't interested in going into teaching right away, and I wanted to stay connected to the university. And so that's when I learned about CERAH. There was an internship posting for a 1-year contract, and I did an interview for that, and I was not successful. But about a month later, an education planner position became available, and I was contacted by Dr. Mary Lou Kelly and offered that full-time education planner position to support the coordination of palliative care for Northwestern Ontario. And that's where I started at CERAH. And I feel like it was relevant to my schooling experience in so much as with a master's in English and Women's Studies, there was opportunity for me to work on developing curriculum, but also specifically for marginalized populations, which was an important thing for me personally that I wanted to see my career move forward in. And I'm very thankful for the last 6 years specifically, where I've been working very closely with Holly to support that education.
And Holly, you spoke about your personal experience with caregiving, and it's great to know both of your professional and academic backgrounds and how they work towards the work that you do there. And you've had personal experience with caregiving. Jessica, have you as well?
Yeah. So when I began working at CERAH, I was a bit younger. And at the time, I hadn't really had the opportunity to care for a loved one myself, aside from peripherally supporting my grandparents alongside my parents. More recently, my dad's been diagnosed with metastatic prostate cancer. And so I've had the opportunity to grow into a caregiver. And I'm very grateful for my career experience in palliative care and the knowledge and the connections that it's afforded me, especially as we are currently caring for my dad and as we look ahead to what that is going to look like.
And similarly, like Jessica, before I started actually working at CERAH, I had cared for many loved ones who were sick, and some of them who had journeyed back to spirit world, but I wasn't really completely involved in organizing and delivering the care. That was more of my mother's role. So in going through those experiences, I don't think I really fully appreciated the needs and the feelings and the challenges and the strengths of caregiving. So after I started working at the center and really became more involved in palliative care, I had the honor and privilege of caring for my own mother in my own home in the city of Thunder Bay. And I remember going through that experience thinking about how difficult it was for me, even though I had access to an amazing palliative care team who at the time were all my friends and colleagues. I had a hospital 5 minutes away from my home. I had services in my home. I had access to a pharmacy literally right across the street. And I remember reflecting back on that experience, thinking, if it was this difficult for me with all of my knowledge, with all of my experiences, with having my mother's palliative care team, on speed dial as they were all my friends, I couldn't imagine how difficult this was for Indigenous peoples living in rural or remote settings, who had limited access to formal services, with accessing medication being a challenge, really recognizing how quickly your loved one's symptoms can change. So that experience in particular gave me such a personal perspective to the work that I do in Indigenous communities. And I recognize that while we at the center really focus on those macro things like policy, like research, like education, I do this so that perhaps the work that we do can make a difference for one caregiver who is sitting at the bedside supporting their loved one.
We're certainly hoping that both of you sharing this information and your own personal stories are going to help connect with someone that might be listening today. And I think it's so important that we talk about this intersection of culture and caregiving. And we've had the opportunity to do it with a guest that's part of the South Asian community. And there are so many components that go into the experience as someone being cared for and being the caregiver that, language, food, access to healthcare, just being in a place where you feel seen and heard. And I'm sure all of that is part of what the work that you do. Let's talk about, on that note, why the center is such an important resource specifically for Indigenous communities.
So as we had mentioned, the center does have our 4 key priorities, one being the Indigenous Peoples Health and Aging Division. So when we think about the Indigenous Peoples Health and Aging Division, one of the things that we do is really focusing on conducting culturally relevant research by and with Indigenous peoples. So as the lead for the Indigenous Peoples Health and Aging Division, recognizing that I am an Indigenous person myself, I think it's a really driving force in the work that we do to have it Indigenous led. So our division is really a recognized leader when it comes to palliative care research and the delivery of palliative care education for Indigenous communities. So back in 2005, a research team that was based at CERAH and led by Dr. Mary Lou Kelly and myself began partnering with Indigenous communities across Canada and focusing on conducting community-based palliative care research and education. And through that work, we had really recognized that education for healthcare providers, family members, community members, was really recognized as a key to really building and sustaining a successful palliative care program in Indigenous communities. So as a result of the needs identified by communities, we created numerous relevant, culturally relevant tools and resources in collaboration with Indigenous peoples. All of those tools and resources are available on our CERAH website. So we are also a repository of tools and resources that have been created by Indigenous peoples.
Do you need more resources to help you on your caregiving journey? The Ontario Caregiver Organization online learning library is here to help. With 24/7 access to quality education and training, our learning library is the perfect way to upskill and gain the knowledge you need to provide the best possible care. With an abundance of online courses, videos, and other training materials, you can learn at your own pace and on your own time. Get started today and unlock the potential of becoming a more confident caregiver with the Ontario Caregiver Organization online learning library. Visit ontariocaregiver.ca for more information. That's ontariocaregiver.ca for more information. So that really brings us to this entire focus that the team has on Indigenous health equity and palliative care, and speaking about developing a curriculum for caregivers in Indigenous communities. Can you tell us a little bit more about that educational initiative and how you're developing the resources and tools for caregivers in Indigenous communities?
So to help to ensure that our curriculum is culturally appropriate, we recognize and respect the cultural diversity of Indigenous communities' experiences, knowledge, and teachings regarding caregiving, health and wellness, and death and dying. So as a result, our curriculum is not grounded in any community's particular local traditions, values, and beliefs. Rather, the curriculum uses the holistic teaching concepts of the Indigenous wellness framework that focuses on health and balance, which is then combined with the holistic focus of palliative care. We also recognize the interconnection and interdependence of the spirit, emotion, mental, and physical aspects of health, and in turn, caregiving. There is also a recognition of the importance of family and community who are there to support individuals in their journeys. So when a person is diagnosed with a serious illness, we tend to rely on formal healthcare providers. These formal healthcare providers do have a role to play in meeting a person's spiritual, emotional, mental, and physical care needs. However, we need to acknowledge that dying is not a medical event, but rather a social event that happens in family and in communities, with the primary responsibility of care really falling to the family and community. So Indigenous communities have identified the need for additional support in educating family and community caregivers on palliative care. So as a result, we have developed a new online curriculum for community caregivers called Walking Alongside Indigenous Peoples Who Are Seriously Ill, Education for Community Caregivers, which was just released on June 28th, 2022.
And the curriculum is designed as a train the trainer type of curriculum, where the intention is that health and social care providers would first have some basic knowledge of palliative care. They would then feel more confident in providing education and support to other healthcare providers, community members, and family who are caring at the bedside. The curriculum may be of value to healthcare providers who want to create awareness in the community about chronic disease management, or educate people about advanced care planning, maybe have other healthcare providers who are new to the field or need some guidance in developing a care plan, or also have a family or community caregiver who has questions about caregiving or who would benefit from instruction in learning skills at the bedside. And we partnered with St. Elizabeth Foundation and Mama Wasing North Shore Community Health Services, Canadian Virtual Hospice, and used some of their resources in our curriculum. We also worked with a curriculum advisory committee consisting of an elder from Peguis First Nation, along with Indigenous and non-Indigenous healthcare providers who reviewed the curriculum and provided feedback on the content and the process, and helped to ensure that the curriculum was culturally relevant and met the needs of the communities. We also received funding from Indigenous Services Canada, Ontario region to develop the curriculum. The curriculum itself is organized into 9 sections, and I will share those here. We have the Indigenous Wellness Framework, spiritual, emotional, mental, and physical wellness sections. And I'll also note that the physical wellness section is further divided into 4 subsections, including helping people move around, personal care, pain, and managing other symptoms. And then the remaining sections include making your wishes known, developing a care plan, the palliative approach to care, as well as last days and hours of life. Each section has different components to it, including slide decks with speakers notes, which have been developed to help health and social care workers teach family caregivers, community members, and other health and social care providers about important aspects related to caring for someone who is seriously ill. And there's also a number of supporting resources, including videos, handouts, pamphlets, and activities. And they are intended to support the understanding of a particular topic, skill, or strategy that caregivers and community members may find helpful when caring for someone who is seriously ill. And finally, some of the examples of tools that may be helpful to caregivers include handouts on understanding and promoting spiritual wellness, or a pamphlet on supporting the caregiver and the family. And also there are videos, as I mentioned, or specifically a video on self-care and a tip sheet on how to avoid burnout. There are also more videos on personal care that demonstrate how to move someone, how to prevent falls, and how to give a bed bath. There are handouts on pressure sores and infection control and how to do good mouth care. In providing education on advanced care planning, there's a booklet called Coming Full Circle, Planning for Your Care, which helps people to reflect on their values, beliefs, and wishes for future care. Lastly, there are also handouts and pamphlets on what to expect during the last weeks and days of life. The curriculum is a national resource, and it's free to download from our website.
That's incredibly thorough. And I know that our readers are going to be, it's incredible that this has all been put together by yourselves and your team, and that it can be a potential resource for some of our listeners. Holly, can you perhaps touch on, and you've talked about this a little bit already, but some of the differences in caregiving responsibility, specifically within the Indigenous community?
Absolutely. So death in Indigenous communities is really viewed as that social and community event, with caregiving being provided by family and community. So family and community networks are important to Indigenous peoples, and that concept of kinship is really woven throughout the fabric of the culture. So as Indigenous peoples face serious illness and end of life, research has really shown that sometimes connections to the family and community and land may be actually more important than accessing specialty services, especially if that means they have to leave community. So really involving family and community are important for those traditional and cultural practices and ceremonies that may need to occur in order to ensure that that spirit is strong to transition back to spirit world. So preparing for death really involves many cultural and community-based practices. It's also an important time to pass on knowledge, stories, and teachings. As I said, connection to the land is really important for people who are dying. We have heard from so many people that they'll say, I was born on the territory, I want to die on the territory. So as we move through that cycle of life as Indigenous peoples, we really frame these understandings through our own family and community-based teachings and cultural knowledge. So we recognize that when care is delivered in community, people receive support by the entire community. They have access to culturally safe and culturally relevant care, including access to traditional language. And the community really comes together to support that individual, which is a natural emerging process of caring for one another.
Is there anything in specific anything specifically that you could say are the challenges and barriers that caregivers face within Indigenous communities?
Yeah, so before I talk about the challenges, I want to acknowledge that we as Indigenous peoples have been caring for our own community members who are very sick. We have long-standing cultural and community-based practices and knowledge for caring for people at end of life. However, those westernized healthcare systems were imposed, which did not value our knowledge. So Indigenous peoples typically do not seek medical care until very advanced stages of illness. And there's a number of reasons for that, including a mistrust of the westernized medical care, racism within the healthcare system, as well as having limited access to healthcare providers or services right within communities. We also experience many challenges in accessing equitable and culturally relevant healthcare. So the westernized healthcare system has medicalized dying and has removed it from communities' experiences. So we have a lack of culturally safe palliative care services and education that really reflect our physical, cultural, and social needs of communities. In addition to that, jurisdictional issues in service delivery also creates barriers to seamless transitions and access to quality end-of-life care. So as Indigenous peoples, in particular, those that are living in First Nation communities, people move between two systems of care. So we have the provincially funded healthcare system, like hospital settings, and the federally funded healthcare system in First Nation communities, such as the Home and Community Care Program. Each system of care provides different services, different levels of funding, and they don't really communicate, and they don't know what the other provides. And this is really evident when it comes to hospital discharge planning and the problems that occur when discharging clients back to community.
I wanted to bring up a statistic that sort of highlights how important, for yet another reason, our discussion today is that Indigenous people are the fastest growing segment of the Canadian population. According to Statistics Canada, Thunder Bay has the highest proportion of Indigenous people in Canada, which is 12.7% of the population, and 78% of First Nation communities in Ontario are located in Northern Ontario. So, this is addressing a huge component of our population, the work that you do, and it's very important. My next question is that chronic diseases such as diabetes, cardiovascular disease, respiratory problems, asthma, and cancer have been identified as the primary concerns, or health concerns, I should say, of Indigenous people living across Canada. Can you identify some gaps in programs and services for Indigenous people, in particular in Northwestern Ontario? And also, in your opinion, what can be done to fill those gaps?
Absolutely. So what we're seeing now in communities are those high rates of chronic illnesses and lower life expectancy compared to non-Indigenous peoples. Indigenous peoples' access to equitable healthcare remains one of the most challenging and complex areas to address. So Indigenous people would prefer to receive care in their communities by their own community healthcare providers, but the majority of people have to leave community and die in regional or urban hospitals, really displaced from their communities and culture, traditions, language, and families. So there is that lack of formal healthcare providers in community, and caregiver burnout is a concern, where healthcare providers working in Indigenous communities are the sons, daughters, nieces, and nephews to the people that they are caring for. It is a really unique experience that you will not witness in any other community, even a rural community. What we're also seeing is communities are in fluctuating states of crisis due to things like traumatic death and suicide, which overshadows that natural dying process and expected death. So all of these things really contributes to reducing the quality of life for Indigenous peoples and that overall burden of disease that needs to be addressed during end of life. And this is where, when we're looking at those gaps, when we're looking at those services, when we're looking at these jurisdictional issues that Indigenous peoples experience, this is where education and culturally relevant research can come into play. This is where we're able to amplify Indigenous people's voices. We're able to hear from their experiences what their needs are, and also support them through capacity development initiatives in order that they can look at addressing their own gaps, their own services. So it's really about, utilizing education, utilizing research as tools to help support capacity in Indigenous communities. That's the important piece of it. And that's where the center is able to help support and fill some of these gaps. We're able to broker knowledge. We're able to look at things and successes and innovations across Canada. We're able to share those with Indigenous communities, and then Indigenous communities utilizing their own capacity, their own human resources, their own elders, their own knowledge, can then figure out what works for their community. So as we say in the education, we're here to deliver education. We're here to provide a lot of information. Take what works for your community and you can leave the rest. And similar to research, in conducting research with Indigenous peoples, we never conduct research on Indigenous peoples. It's really coming from their needs. It's utilizing methods and data collection methods that work for them so that we can make sure that whatever we're doing is culturally relevant and appropriate for communities' experiences.
It's evident to me from our conversation that you're addressing a huge need in terms of, culturally relevant healthcare, culturally relevant research that supports that healthcare. And, we know that this is a very large segment of our population that does not feel that they are getting the equity that they deserve and need. Do you feel that across the board in Canada, based on what you might know, that there is need for more culturally relevant research? Are there other centers such as yourselves, the one that you work at CERAH, that are really addressing this issue? Or what can you say about that? Do you feel that there is an additional need for that right now?
So when I started this back in 2003, when I was going to do my master's, and I was looking at my literature review, and I came across two articles on all of the resources that we have in this world that focused on the experiences of Indigenous peoples at end of life. So when I began, there was a huge gap that needed to be addressed. There was a huge gap where knowledge needed to be developed around. So what we know, though, is First Nation and Indigenous peoples hold tremendous amounts of traditional community-based knowledge and expertise in really negotiating the personal, familial, and community experiences at end of life. However, they really lack a lot of those health services and other supportive community resources to meet the growing need for palliative care, especially for people with chronic and complex high-intensity care needs and for people at end of life. So when we look at palliative care and end-of-life care globally, what we see is increasingly understood to be basic human rights. Yet, despite the emphasis globally on improving access, we still have a profound lack of equity across the world as Indigenous peoples. And one of the things that is common across all Indigenous peoples is the impact and the harm of colonization. Mm-hmm. And colonization isn't something that just happened in the past, it continues today. So when we think about the need for culturally relevant research and education and health services, we need to recognize that Indigenous peoples have to lead the way forward. We have to develop our own approaches to caregiving for people at end of life in order to achieve that equitable and culturally safer care. This includes conducting research and developing education that is community-led, that recognizes and respects Indigenous knowledge, that is based on relationships, that's founded on decolonization, and really a strengths-based approach that amplifies Indigenous people's voices. So through things like community-based initiatives, there's many Indigenous communities that are developing caregiving models and practices based on their own individual family and community worldviews. And that's what we need to build upon. And the healthcare system, the Westernized Eurocentric healthcare system, needs to be there to support that, support the understanding of health, to support these caregiving protocols and policies that's being developed in Indigenous communities, and also utilize their tools and resources to amplify those programs across Canada.
If there was something that you could put out there in terms of what you would like to see change in the system right now in the next 5 to 10 years, is there anything that you can suggest, sort of a wish list in terms of how we could move in this province to a more equitable future of healthcare for Indigenous people in palliative care?
So I would say there's a couple of things. The first thing that I would ask for is that palliative care in Indigenous communities, that it becomes funded. So currently right now, palliative care services are not funded in Indigenous communities. It's not considered an essential component of the federally funded home and community care program. The second thing that I would like to see is really getting the provincially funded healthcare system and the federally funded healthcare system to come together to talk about those jurisdictional issues and barriers and gaps in services. Because we can do as much as we can in Indigenous communities to improve that care, but we always run into those challenges when it comes to transitioning back and forth between these two systems of care. Discharge planning is a huge concern, and that's something that in my 17 years of working in this field has not been successfully addressed. There are pockets of excellence that are happening around that. Our own hospitals are looking at adapting and enhancing protocols to discharge Indigenous peoples back to community, but it's not a standard of care as yet. I know there's a lot of initiatives happening nationally that are looking at identifying some of those needs and resources for Indigenous peoples. And I think so the continuation of, creating that space to amplify Indigenous people's voices, our knowledge, and the recognition that our knowledge is of important. It is valued. It's necessary in order for us to access culturally safer care. And I think the last thing that I would say is, healthcare systems were never designed for Indigenous peoples to succeed. So we have to remember that. So I think the only thing that we could ask is for culturally safer care, because I don't know if systems will ever be culturally safe because they weren't designed by us. They weren't based on our values and belief systems. So looking at how can we deliver culturally safer care, both as individuals and organizations.
But I think to answer your question as well, if I were to think broadly about what I hope that more Canadians, more settler Canadians will take an interest in educating themselves and really recognizing the role that we have to play in order to make these systems and some of these things that Holly mentioned better. It really comes down to the individual at this time to learn and figure out at an individual level what can be done to make some change.
It's really evident to me that the work that you do at CERAH is incredibly important. So I'd love our listeners to find out more about it. So where can we direct them to find out more information about the center?
Absolutely. So as mentioned earlier in the podcast, the curriculum is on our website, and the website address is cerah.lakeheadu.ca. And we also have a Facebook page. If people want to visit us there, they can go onto Facebook and search Center for Education and Research on Aging and Health, and we will come up. And we also have a YouTube channel where we house recorded education sessions, and people can go onto YouTube and search Center for Education and Research on Aging and Health, Lakehead University, and we will come up there as well.
Fantastic. Holly and Jessica, I thank you both so much for being here today and sharing your knowledge, your expertise, and all the information about the work that you do at CERAH. It's really most appreciated.
Miigwech, Michelle, and miigwech, the Ontario Caregivers Organization, for inviting us here to do this podcast with you. And I hope the listeners find these tools and resources valuable. And also, if they have any questions, they can reach out to us. And if we don't have all the answers, we'll definitely find out who has. Miigwech.
Thank you.
Thank you. Have a great day. Thank you for listening. We hope you enjoyed this episode. You can access more details about support services on our website, ontariocaregiver.ca. Until next time, I'm Michelle Jobin, and you have been listening to Time to Talk, a podcast for caregivers. We hope you have a wonderful day.